Hi, my name is Won-hee Oh. I'm a third-year medical student at National College of Natural Medicine, and today we're going to be learning about hypothyroidism. Let's take a look at this animation.
Your pituitary gland produces a hormone called thyroid stimulating hormone, or TSH. TSH stimulates your thyroid gland to produce the thyroid hormones. An underactive thyroid, or hypothyroidism, is most often caused by a problem in the thyroid gland itself. It can also occur because the pituitary gland isn't producing enough TSH, but this is less common.
So let's talk about what can cause hypothyroidism. The most common cause of hypothyroidism is an autoimmune disorder called Hashimoto's disease. Many things contribute to hypothyroidism. They include poor liver or gut function, a sluggish pituitary gland, too many thyroid binding proteins in the bloodstream, and immune dysfunction. Some of the other factors to consider are stress, gluten intolerance, and insulin resistance. So let's talk about some of the signs and symptoms of hypothyroidism, and here are a few. Chronic fatigue, chills, dry hair, irritability, poor concentration, and constipation. If you're suspecting hypothyroidism, you can start by a simple test at home before going to see a doctor by taking your basal body temperature. To check for your basal body temperature, first get a full night's sleep. Then when you wake up in the morning, take and record your temperature while you're still in bed, preferably under your armpit. Follow these steps for 3 days in a row. If your average temperature is below 97.8 degrees Fahrenheit and in conjunction with other signs and symptoms, it's recommended that you investigate it further. Now let's find out what kind of lab tests are used to diagnose hypothyroidism. Thyroid stimulating hormone level is the very first marker that doctors test for. Sometimes, this may be the only screening tool. However, diagnosis based on TSH level can be very inconclusive. These are some of the other lab tests you should consider, especially if your lab results indicate that your TSH level are normal, but you still have symptoms. It's also important to take a look at their medical history, prescription drug use, use of oral contraceptives, and estrogen cream use. To treat hypothyroidism, it's important to understand these 6 patterns of thyroid dysfunction. 1. Primary hypothyroidism. This is actually the true dysfunction of the thyroid gland. This is the only pattern of hypothyroidism that can be effectively managed with thyroid replacement hormones. 2. Hypothyroidism secondarily to pituitary function. This is a fatigue or dysfunction of pituitary gland caused by chronic stressors. This can be caused by a busy lifestyle, poor diet, inadequate sleep, too much caffeine, high carbohydrate diet, and chronic inflammation. 3. Thyroid underconversion. Excess cortisol suppresses the conversion of T4 to T3. This is associated with chronic renal stress and excess production of cortisol. 4. Thyroid under overconversion and decreased thyroid binding globulin, also known as TBG. Excess testosterone in women can cause too much T4 being converted to T3. This is more prominent in women with insulin resistance or polycystic ovary syndrome. 5. Thyroid binding globulin elevation. Excess TBG binds to more thyroid hormones and prevents it from entering the cells. This is seen in women on oral contraceptives or estrogen replacement therapy. 6. Thyroid resistance. Elevated levels of cortisol causes the cells to become resistant to thyroid hormones. Although the right amount of hormones are being produced, hormones cannot take effect. So in conclusion, to effectively treat hypothyroidism, it's important to understand that underlying cause of hypothyroidism is not just your thyroid, but a myriad of other factors that play a role in affecting your immune system. This is why hormone replacement therapy alone will not be effective, and lifestyle changes must be made. And the recommended lifestyle changes are 1. Enjoy gluten-free, dairy-free diet and avoid processed foods. 2. Get lots of sleep. 3. Cut back on caffeine. 4. Avoid oral contraceptives. 5. And the most important step, reduce stress. Thank you for watching my video, and if you would like more information, check out this book, Why Do I Still Have Thyroid Symptoms?